Victoria's president of the Australian Medical Association has slammed the Andrews government for their handling of the COVID-19 crisis, calling out the lack of transparency and inability to learn from mistakes. It comes as the state records 4 new positive cases in Melbourne's north. Professor Julian Ratt joins us now. Professor, good morning to you. Some really strong words there. Did the Andrews government fail Victorians, and how did they?
Well, I think that we've seen again with this latest outbreak that there's been some confusion about contact sites. And as you would be aware, there was a readjustment from Epping to Epping North Woolworths with the first particular case, and now we've seen this cluster emerge in that area. Now, while it's not really clear whether those two situations are linked, it does reinforce the need to be absolutely vigilant about contact tracing, about the details of the exposure sites, so that the public can be well informed.
How do you get that wrong?
Well, it surprises me. Apparently they used a banking app, and I don't know about your banking app, Carl, but mine's not very reliable when it comes to exactly the locations of those charges and costs that appear on it. So the fact that it really wasn't double-checked does surprise me. I think any police investigator, for example, would know the need to verify information or get various different sources to confirm a site, and obviously the contact traces have let us down that particular instance.
But given what's happened in Victoria and in particular Melbourne over the last 18 months, I can't fathom how they can't get the basics right. The people of Victoria deserve more.
Well, I think the reason is because there just hasn't been investment in public health infrastructure in Victoria like there has, say, in New South Wales. New South Wales, I think, has 40 different public health units which have specific local knowledge. And one wonders whether, in Victoria's case, whether if there was local knowledge here, people would have quickly realised that, well, there's more than one Woolworths in Epping.
Yeah.
And certainly in my suburb, there are multiple Woolworths. And so to just say there's one and assume there's one is obviously erroneous.
I guess not knowing where this has come from too adds to that psychological burden for Victorians. I know plenty are shattered and nervous about the coming days. The 4 cases so far, you'd expect that to increase dramatically, would you?
Well, yes, there's a 2-week gap between the previous case that we know about in the adjacent suburb of Wollert. So that obviously, given that and the fact that that person was infectious over 2 weeks ago, there must be some intermediary cases or a case that's led to this further outbreak now in the adjacent Whittlesea area. So there's a very intense hunt on at the moment to try and join the dots and make sure that they can find those intermediary cases, any consequent cases from that original case that we saw from hotel quarantine in South Australia.
Given the way the government's handled these in the past, I mean, I was surprised, I'm sure others were, that there wasn't some kind of local lockdown.
Well, I think that's certainly on the cards. You know, at this stage, they're going to look for further cases. The other risk, of course, is that given the 2 weeks that's occurred between that original case and this one and this group, the worry is, of course, that it's spread elsewhere in Melbourne, and so there's a risk that there might be multiple cases, of course, at this stage, and that's what the government, I'm sure, is very concerned about.
Should Victorian people have faith in their government in handling this latest crisis?
Well, I think that it just emphasises again that there needs to be long-term investment in public health. That you can't just reinvent a first-class contact tracing system overnight, although they've tried to obviously upscale it over the past 12 months. But really, this requires years of investment and really building expertise in a number of different personnel so that they actually can have very sound public health knowledge, contact tracing experience, and also the local knowledge that's required to really perfectly follow up cases in various different suburbs.
Professor, your last day in the job, I hear today. All the very best. We appreciate your time today.
Always a pleasure, Carl.
Thank you. Ali.
Well, for more on that COVID cluster in Victoria, let's go to Deputy Prime Minister Michael McCormack in Canberra. Thank you for your time this morning. How confident are you that Victoria can get on top of this quickly?
Well, the AMA president there didn't mince his words, did he? And of course, it has been a concern all the way through. New South Wales has been the exemplar when it comes to making sure that tracking and tracing methods were put into place, and if there had been any little outbreaks, they were nipped in the bud very, very quickly. And unfortunately, we've had more than 800 of the 910 deaths that we've tragically had in our country from COVID-19 since the pandemic first hit these shores in Victoria. And so I'm sure that public officials there, public health officials and authorities will be scrambling very quickly to make sure that they endeavour to get all those cases and get the situation sorted.
Yeah, we're all hoping that, and it happens very quickly. Were you surprised that no restrictions were introduced yesterday?
Well, this is a matter, of course, for state health authorities, and this is a matter for Victoria, but they need now to very quickly move to ensure that people who may well have been near those who have been infected, that they track them and that they can go into self-isolation.
We are waiting on genomic sequencing, but the possibility is that it's linked to the Adelaide Hotel quarantine breach. It does add to the pressure to plug those holes and fix the system.
It does, but when you consider, I mean, people need to be alert, not alarmed. People, we need to get our economy going as best and quickly as we can, and that's why our budget recently was so successful in making sure that we've put the right measures in place, that we get the economy and our states opened up as quickly as possible. What we don't want to see is state premiers pressing any panic buttons and closing down their entire states, because we need open borders, we need people to be able to move freely throughout our country, and we need the economy to, of course, make sure it can tick along nicely, as it has been, thanks to the measures that we've put in place.
Do we need to put on our skates and hurry up those regional quarantine hubs?
Well, in fact, we're doing that just now, and certainly Commonwealth's happy to work with the Victorian Government about any proposal. I know those discussions have been fruitful and productive thus far, and we'll certainly make sure that bringing Australians home, we're doing that as well. This is a situation, of course, where it's been going on for some time now, and there's new things happening all the time. There's no manual you can open up and say, well, this is what we do to address this particular situation. But so far, we've been very good at keeping the case rates at a minimum. We've been keeping the death toll, of course, at an absolute minimum. It's very sad for those 910 families who've lost loved ones, but we're all in this together.
Minister, as you know, we still have an issue with vaccine hesitancy in this country. Do we need to be looking at incentives and perhaps even a campaign like we've just seen China unveil to overcome such issues? Just take a quick look at it.
疫苗都有身份证，查查号码就可辨认。一人一苗一码全程可追溯，绕您360度，提供最佳保护。
Can you rap?
Not very well. But look, getting young people encouraged to get out and get their jab is important, and maybe we could, maybe ScoMo or someone could do a bit of a rap, probably better than I've just done, but maybe Carl and Ali could, indeed yourself, could perhaps do something like that for us.
OK, to be clear, I think every suggestion you just made is a terrible one.
But
if you want it to be effective, you're going to have to...
The enthusiasm is there for people to get out and get that jab. It's so important. Get both of those jabs, and do it for yourselves, do it for your families, do it for that stranger you've never met, because that's so important.
Yeah, I mean, I do think we need to be pushing ahead with something along those lines. I know that China's looking at 20 million doses a day. I mean, if we could do that, we could vaccinate our country in 2 days. But while we've got you, you've also got a major announcement for the regions.
Yeah, $50 million as part of the round 6 of the Building Better Regions to promote regionalisation, to promote decentralisation, to get those community hubs, to get people into our regions. Of course, 43,000 people made the choice last year to go to our regions, big enough in which to get a good cup of coffee, small enough to still care. That's our regions, and we want to encourage more people to take that move.
And just before we go, I'm going to bring the song back. Show us one more time. I apologise, everyone. Deputy Prime Minister, thank you for joining us this morning.
Thanks,
we always
Ellie,
appreciate
anytime at all.
it.
I think he moves beautifully, Michael McCormack. Beautifully.
Better than you right now.
Hey, what do you mean?